माचो येवकार. सगळे आमचे CCR TV पळयणाऱ्यांक a warm welcome, and we have our program on health, and that is called Tumchi Bolaiki Tumche Hatan. Your health in your hands. We have our specialist in pathology, ex-head of the pathology department of the Goa Medical College, also the ex-head of the Goa Medical College blood bank, and involved now in international conferences and attended several conferences. Is impossible to have the exact number and the way that he is going through. Welcome, Dr. Wiseman Pinto.
Thank you. Obrigado.
We have a special episode today on diseases in urology. When we talk of urology, we are going to talk about kidney, prostate, urinary bladder, then a lot of problems that we see nowadays on stones, infections, cancers, and I am not very sure whether our viewers know about kidney transplants. And we have Goa's leading acclaimed urologist with us, who has done his MBBS at the Goa Medical College, MS in General Surgery also in Goa Medical College, DNB, which is equivalent to MCH in Urology, from Bombay Hospital, Institute of Medical Sciences and Research in Mumbai. He joined the Goa Medical College and set up a full-fledged department of urology. He is known all over Goa. I think all those who suffer these problems in urology, they know him. And the Department of Urology has been treating all cases of urology with advanced equipment, technique and procedure in the Goa Medical College. He is instrumental in starting the postgraduate courses and starting renal transplant in Goa, and has got a tremendous knowledge, expertise, surgical skills, clinical skills, and also, I was quite surprised, besides all these skills, he has got also academic brilliance. He has several publications and attended several conferences. He is a pioneer to start organ donation and organ transplant in Goa. We are fortunate and blessed to have such an eminent surgeon in urology, and none other than Dr. Madhu Mohan Prabhudesai. Dr. Madhu Munta tuka.
Yes,
everybody,
definitely.
I know, everybody seems now,
Dr.
Dr. Wiseman,
Yeah.
suffering from some kidney problems, kidney stone, and prostate.
Oy.
And if you meet them and ask them, Dr. Madhu.
Madhu.
Dr. Madhu. And I'll tell you, Dr., not to praise you, people are so happy.
Thank you, thank you.
And you should be acknowledged as the pioneer in urology in Goa. What do you say? Dr.
Absolutely.
Wiseman?
Before Dr. Madhu Mohan came,
Yeah.
many urologists worked in Goa,
Yeah.
the private sector and Goa Medical College as
Yeah.
well.
Yeah.
But nobody could start a full-fledged urology department. It was the dedication, brilliance and intelligence, foresight of Dr. Madhu Mohan Prabhudesai, who started this. And the surgery that he's done is also amazing.
Accomplished.
Accomplished.
He is an accomplished surgeon.
surgeon, urologist, administrator, and he has started now the renal transplant
I was quite surprised that in Goa now,
in Goa.
we have all this.
All this.
And transplant,
Yes.
kidney transplant.
Yes, yes, yes.
Doctor, how could you come and gain such a prominence?
It's a God's grace and my parents' blessings, what to say, and love of all of you all has helped me to get whatever I could do for our state.
Well, I have come across you when my wife was there in the hospital. You were very cool, calm, and nobody would say that you are one of the most sought after urologists. Nobody would say. You look at him, such a simple, dignified person. And, of late, I have a friend of mine who is now being treated by you. Before that, I had another one. So many of them who are under your care, all of them are very, very happy.
Thank you.
You must
God.
be having some magic. I don't know what it is.
He's a good team leader also.
Yeah. But, Doctor, you have to share with our viewers.
Yes, definitely.
And we have lakhs of viewers all over the world. Problems of prostate are increasing. Prostate of kidney stones are increasing. And these kidney stone problems I have come across when I was the secretary of the Goa Football Association. Young footballers, even playing in ISL and I League, अरे तुम बुर्ग मरे है ना दोतर मादो हा तो कोत मागा ओकोदिता सगळा बर जातो हाय हेटोलो. You know, Doctor, they had that confidence in you to say that I have a problem, I have pain, but he is like God to me. Doctor, could you share with us why there is sudden, for me it is sudden rise, why there is sudden rise in prostate especially, and kidney stones, and of course urinary tract infections?
This question is very, very pertinent and important in urology. The maximum cases of urology are because of kidney stones and prostate. Now, let us take one. Now, prostate. Prostate is as the age increases of a person, the prostate gland, which is a normal gland, which is there in a human body, will start enlarging. And when it enlarges, it comes in the way of urinary passage. Since it is coming in the way of urinary passage, the patient starts having symptoms. So, somewhere around 50-55, slow symptom starts, but majority of the symptoms after the age of 60. Now, what are those symptoms? The patient starts passing frequent urination. He has to go frequently. In the night, he has to get up more than 1 or 2 times. He takes long time to initiate urine. Suppose he get an urge to pass urine, he cannot hold till he reaches the bathroom. Sometimes the urine starts leaking. Sometimes it happens so that while passing urine, he gets a burning pain while passing urine. Few of the people will get blood in the urine.
Blood in the urine.
Urine, which also can be one of the prostate enlargement is one of the cause of it. So these symptoms, when it starts, they are the initial symptoms. And when somebody is having these symptoms, always there is a tendency to neglect this symptom because they are considered as a part and parcel of the life. If you detect enlargement of the prostate is the cause for these symptoms in these patients, they can be treated very early and can be controlled, rather than when they come at a complicated stage where surgery, that is the only answer. So the prostate problems can be treated very well with the medicine if they have been picked up early. And it is an age-old process. It is not considered nowadays as something called as disease, but it is a component of an age-old person. That does not mean that every older man, aged man, will always have a symptom, but can have an enlarged prostate. They are called a silent prostate.
That means there could be no symptom.
No symptoms. So in those people also, it is advocated to have a regular check of the prostate after the age of 60, so that the dreaded complication or conversion of a enlarged benign prostate into a malignancy, that is called cancer, can be detected or can be prevented. So that's why people who doesn't have a symptoms also after the age of 60 must regularly should go for yearly testing of certain blood, which we will discuss later on. So that's about the prostate. Now come to the kidney stones. Now the kidney stone incidence has increased dramatically. It has been exponential rise of a kidney stones. There are multiple reasons probably in Goa. One of the commonest reason is inability to drink enough water. Water should be consumed very well. Your body should be hydrated very well. Second is increase salt in the diet. Mind increase salt म्हणजे मीठ मीठ जो जास्त घेतले, this salt increased salt directly proportional to the production of kidney stones. Why? Increased salt म्हणजे सोडियम बॉडीत एक्स्ट्रा झालं की सोडियम किडनी प्रिझर्व करता and sodium preserve करतकूच calcium the kidney throws out, and calcium in the urine is a precursor for formation of stone. Third is the diet, and the most of the diet, when it is becoming too much of salted diet, too much of non-vegetarian diet, particularly the red meat, particularly the shellfish, the prawns or the crabs, which has a high amount of uric acid. This diet predisposes you to production of stones. So these are the very important factors which I feel in Goa has been rising. People don't drink water, neither they space the water drinking. They may drink at a time. That is not a concept. It has to be spaced till the person sleeps. Second is about the salt intake, because of the packaged foods, because a lot of preservatives are there which are salty. Then different aerated drinks, Coca-Cola or all that, they are stuffed with a lot of salt and sugar. And the consumption of a red meat beyond a certain limit. Not that red meat should not be consumed. In a proportionate manner, if you consume is fine. But if you consume it, that is the only diet, and that should not be another diet available, then that's the trouble. That's why our kidney stone number is increasing rapidly. And the fourth is, as you become urbanized more and more, all the habits which normally a normal human being should do in a diet is forgotten. It is always a concept, either because of the stress, because too much of work, no relaxation, no time available for oneself, and forgetting that plain water is more important than aerated or a colored water. So this concept slowly dies down, is a part of an urbanization, which is all over the phenomena. It is not only the problem of Goa. So these are the factors, social as well as the dietary and how you behave, are responsible for increasing the kidney stones. Yes. Third, last you said about urinary infection. Correct?
Yes.
This is very, very common. Now, urinary infection is, what is urinary infection? Infection म्हणजे जंतू मूताच्या मार्गात येवप. Now, from where they will come?
Yes. That is there.
They come when our hygiene is not proper. Whether it is a male, whether it is a female or a kids. So hygiene maintenance is very crucial. There is a production of these bacteria coming directly from an outside source. That is not the only reason. Urinary infection can happen from bacteria which has entered from the body from some other means also. It can enter through while we breathe, it can enter through the skin, and from there they are called a bloodstream. They make a way into the kidney. And third is when our own immunity is decreased. We are surrounded by so many organisms.
Yes.
As sir is expert in this. Obviously he knows, he has seen so many. So when this type of organism are available on our skin and in our surrounding, and for some reason our immunity is down, when it will be down? The people who are diabetic, people who are on the medication which decreases the immunity, or the people who are not taking a balanced diet, they are immune, their immunity has gone down, त्यांची प्रतिकार शक्ती कमी झाल्या. So these bacteria, these viruses make a way into the system which normally our body will have fought and killed them, and that is the reason our urinary infection rate is slowly increasing. Similarly, the urinary infection also can happen if normal vaginal tract is not kept in proper shape. Particularly in the ladies, this is important during their menses period, during their sexual contact time.
Yes.
They have to be very careful in keeping the hygiene in a proper manner. And last is inadequate water, because it doesn't allow you to flush this bacteria. उदक भरपूर घेतकूच, urine भरपूर जातकूच, there is a chance that this bacteria will be flushed off before they colonize, before they enter into the stream.
You have very efficiently simplified,
Simplified, yeah.
for I'm sure our viewers will definitely understand,
yeah.
because for them it was kitko jata, kaise jata, urinary tract infection kitko jata, stones more or less montale the udopina.
Yeah.
Prostate doctor kit munale te tega paya halole paya cancer down to mela, and they were advised baba to 40 45 50 ki you do the regular checkup and all. Prostate number it has gone surpassed all the expectation, but urinary tract te samjha hi na madai rahi, and kidney stones they say to udapina to sark udapina. You have simplified. And I am sure Dr. Wiseman.
Yeah, absolutely. He is Dr. Madhu.
Yeah.
In his characteristic teaching style, has simplified everything.
Yeah.
Stones, Dr. Madhu, as you rightly said, calcium, stones, uric acid, phosphorus, and all these are responsible for precipitating.
Yes.
Sometimes we test them in biochemistry to know if it's a oxalate stone, uric acid stone, etc. So that's nicely you have told. Second, about urinary stones. I know Goa it is rising. It is more common in the warm countries.
Yes.
Like deserts.
Yes.
Gulf countries.
Correct, sir.
But now there's global warming. People, as you said, don't drink water. So the message is very clear. Good hydration. Drink water throughout the day. When you get up, drink water. Again, before meal, after meal.
Absolutely, sir.
It is very good what you have. Not only for the stones, but for
overall health.
All over good health. To prevent our other diseases, lifestyle diseases, which you have rightly told. So, there are two things about the stones, etc. You've also said about urinary tract infection, which is also very good. And you treat it very nicely. There are now, when we started, I started 77, you can say, medicine. That time, antibiotics, Dr. Abraham used to teach us, and Dr. Dome, and Dr. Rosa, the antibiotics, were less. As I passed out, they became second generation, third generation, and today the new generation antibiotics are wondered drugs. So the treatment is much easier than in many years. So antibiotics and
Dr. Madhu, urology now they say it covers urinary system, both men and women, kidneys, adrenal glands, then ureters, bladder, urethra, male reproductive system, penis, testis, prostate, and epididymis. Epididymis मुझे कितने?
Yes. Now, you are told the gamut of all the organs.
All organs.
You are expert in this.
Now, the epididymis is a part which surrounds the testis.
Okay.
So, testis produce sperms. The main function of the testis is to produce sperms and a hormone, which is testosterone, which is a male hormone. Now, these sperms, when they are produced, there are stages in which the sperms are produced. They produce dhatukos, they have to come back into a tract, and through the tract, through the urethra, it has to get intromission during the sexual intercourse into the lady. That's the concept of a transport. The transport jana jata, that tube is called epididymis. But that's a storage atate. They become mature. When the sperm starts becoming mature in the epididymis, because there are certain products, certain substances are secreted by the epididymis which nourishes these sperms, which helps giving nutrition to the sperms. The sperm starts becoming matured, and you get a healthy, good sperms which are motile. Motile means they start moving. Because that's the speed they get. That everything happens in that tube which surrounds the testis. That tube is called epididymis. And that through which it's one of the most important tube during infertility. We have to really concentrate on that organ, because if it is blocked, sperms won't come out. So this is the area through which when sperm passes into the urethra and comes out into the surface. Epididymis is the organ which is attached to the testis, surrounding the testis, helps in maturation of these sperms.
And I couldn't mention about seminal vesicles.
Seminal vesicle is also part of a semen. Now, seminal vesicle is another two organs. Both the sides they are there. It secretes certain products of a liquid form which constitute the whole semen. Now, semen has sperms epididymis is fluid, and majority of the fluid of the semen is coming from seminal vesicles, because it has certain important ingredients, like it requires glucose, that fructose. The name of a glucose is called fructose. That fructose is produced by seminal vesicles.
Is it?
Plus some other enzymes which are produced, which are necessary for liquefying the semen when it is put it back. It has to get liquefied. That all production comes from seminal vesicles. These are the organs, these are the sexual organs which contribute to the total volume of the semen which comes out during an ejaculation.
This part is normally not known.
Not known, yes.
When we
Doctor,
thought only kidney, stone, anything.
Dr. Madhu and Mr. Jovito, all in the last few years, also increase in bladder tumors,
Yes.
bladder stones. So you can share
Yes.
your experience and
Correct. Absolutely, sir. Now, bladder tumor in Goa is very high.
Very high.
Surprisingly
Yes,
very high.
Yes.
Now, bladder tumor normally happens, urinary bladder. When we are talking the bladder, whenever
Urinary
we
bladder.
use the word bladder, it is urinary
Yeah,
bladder.
correct,
Because they should not get mistaken with other bladders.
With the other bladder.
Yes.
Gallbladder.
Gallbladder and all that.
So urinary bladder.
Urinary bladder. So, the malignancy, the cancer of a urinary bladder is high, and one of the reason directly related to the high incidence of cancer of a bladder is smoking.
Smoking.
Yes, 40 times it increases the risk. A guy who is a smoker, and a guy who is a non-smoker, it increases the risk of having a cancer. That does not mean that cancer will happen on him. Risk increases by 40 times,
40 times,
which is a huge risk. And this is one of the largest risk associated cancer, and something which is habits which has been developed, like bladder cancer and smoking. This association is very powerful.
Very strong.
Very strong.
It simply means that it could also affect women, because now they say women are smoking cigarette and then e-cigarette.
Anybody who smokes, whoever uses a nicotine in any form will be predisposed for having a cancer of a bladder. Another reason is, as sir, you must be knowing about the malignancy as a genetic factor.
Correct.
Which is also playing a role in a cancer of a bladder. So whoever are predisposed for those genetic defects, whether their genes are not in a position to correct themselves, they will develop malignancy in any part of the body, so be it urinary bladder. And third is the exposure to the chemicals. Yes. In Goa we don't get that. Like the industries which have certain dyes, particularly paints, the dyes, the cotton industries, where they use certain type of dyes. And these dyes also, exposure to a longer period of time, can develop a cancer.
Correct.
And stones, Joy.
And stones.
Bladder stone also can predispose. Continuous infections will produce
stone. Also one more, in the Gulf countries, they have bilharziasis, parasite, which we fortunately we don't.
It's a very important, sir has brought it out. Bilharziasis is a type of a organism which enters and it makes a house inside the bladder. It has an affinity towards the urinary system. Makes a house and starts burrowing inside. It causes ulcers. Initially they may be ulcers. Slowly these ulcers gets converted into cancer. A typical cancer it is.
So see, as you have rightly said, Dr. Madhu, and now the whole world is globalized. Many people of ours are working in the Gulf, and they could be exposed to this, and they may come back as patients.
Yes, sir. We have seen such cases.
You must be seeing.
Yes,
used to first come to Bombay. When Goa didn't have the Arabs and all, used to come to Bombay, just look and.
When should one see a urologist?
When one should see a urologist, I will divide this into two arms. The guy who has a symptom has to see a urologist, and I will tell you which symptoms. And the guys who doesn't have a symptom also should visit a urologist after particular age group. Particularly, as I said, for the prostate or a prostate cancer, after the age of 55, one visit, and after 60, they must regularly visit yearly to see that their prostate is in good health. Now, what are the symptoms which are important for any general public to come to a doctor, at least to an urologist? One is dreaded problem is blood in the urine. You should not miss this symptom. whenever urine is red, whoever the person may be, a small child or adult male or adult female, has to visit a urologist. Blood in a urine should not be missed. Second, a person who is going frequently to pass urine, maybe there are so many other causes of passing of frequent urine. Diabetes is the commonest.
Yes.
This increase in the quantity production of a urine or frequent urination associated with pain while passing urine or burning pain while passing urine cannot be considered as a normal frequency. This need to be investigated. And the third and the most important, whenever any smallest symptom related to urine associated with fever should not be delayed, because fever coming in infection of urine is always and most of the time is because of kidney infection. We call it as pyelonephritis. We should not be trying to delay it, because the complication of a pyelonephritis, particularly in the diabetic people, is life threatening. So these are the symptoms when they appear to anybody at any age. They must consult a urologist or at least a physician, at least a surgeon who can understand what are the causes of it, and then they can refer to a urologist.
So, you think these cases of increase that we see today, especially kidney stones in youngsters, what are they?
See, as Dr. Madhu has rightly said, the whole lifestyle has changed.
Especially their diet.
Especially the
and
diet,
the
salt,
salt.
water, drinking of water, whatever he has said,
Yeah.
it is true. What about frothy urine?
Yes, very important, sir.
Important.
Many people complain of a frothy urine.
Correct.
Now there are many causes of a frothy
Correct.
urine, obviously.
Yeah.
Urine should not be ideally frothy.
Yeah.
Now whenever a urine is a frothy, either it is infected, either a lot of proteins are going into the urine,
Yeah.
or the person is taking so much of high protein intake.
Ah.
Nowadays all these bodybuilders and these
Yeah,
take
yeah.
the proteins in the form of creatine and all those things,
Yeah.
the outside stuff,
Yeah.
to enhance their body.
Yeah.
Now this finally will get released from the urine.
Urine.
So when they go into the urine, small micro bubbles are produced as they pass, because they are not dissolvable, they are not soluble in the urine. So when they fall onto your commode or anything, the froth comes by the side. Diabetes is one of the commonest cause.
Yeah.
That's why many people have a diabetic will have, because sugar is coming inside,
Yeah.
proteins are coming inside. People who have a kidney failures, early stages also will have a proteins. So this is the very common. But normal human being also can get a frothy
Can get
urine.
frothy.
Yes, because you are
That's also important.
Yes, not that frothy urine means something gone wrong with
Yeah.
person.
If all urine parameters are normal,
Yes.
blood parameters, and you get then
Frothy urine. It is possible because
Correct.
of a diurnal variation, which
Diurnal
we call.
variation.
Yeah, which changes as per the day, as per the night,
As per the
how
day.
he sleeps, how much time he sleeps. So some concentration, dilution, mismatch happens,
Correct.
and you tend to develop a frothy. So frothy urine is
Correct.
not always a disease.
Correct. Yeah. Now, Madhu, one more thing. You being a urologist, you're a complete expert. You also treat infertility.
Yes,
Infertility is quite common,
very common.
and it is increasing.
Yes.
The sperm. I had written some articles on
Yes.
the Y chromosome.
Yes.
I don't know if you read it.
Yes.
On the Y chromosome disappearing and all these type. And also they say the sperm count has been decreasing,
Yes.
over the
Yes.
centuries, over the decades. Because of various reasons,
reasons.
screening,
Yes.
Lifestyles,
Yes,
and
yes.
which we are,
True.
So you get a lot of infertility.
Absolutely.
Male infertility.
Male infertility. Now, as a urologist, we deal with the male infertility.
Male infertility.
Because the female infertility will be done by the
Gynecologist.
gynecologist. Now, why this male infertility is increasing? There are definite causes and there are related causes. Definite causes are that the per person he may have a defect wherein his sperms are not produced. As you said, you have produced the paper which is brilliant on that Y chromosome.
Correct.
They are called Y chromosome deletion.
Yes, exactly.
Y chromosome disturbances. Y chromosome is a male chromosome.
Male chromosome.
So this chromosome is required to production of a sperm. Very important.
Very important.
So this is inherent problem in that person. Plus inherent problem what you said, Jovito, about that epididymis and the seminal vesicle, they may be faulty, they may be blocked. So the sperms doesn't come out. Similarly, the testes itself are not developed well from the childhood, because they were not there at the time of birth in the scrotum, they may be little up, they are called undescended testes, or to certain level, certain hormonal changes may affect those testes. There are so many hormonal diseases, endocrine diseases, which can affect the testes. So the production of the sperm by the testes is decreased. These are definite causes which is present in him, which is present in that individual. Now there are added factors nowadays why the infertility rate is increasing. Number one, stress. Sperm is a very sensitive person. Sperm is a half human, correct? So sensitive it is, how we get affected, sperm gets affected. So his quality, his character.
You have made it very interesting and very practical.
Yeah. So it is going to affect him. The stress what we take, it will pass on to that sperm. And it is quality which one is get affected, is motility. It is his numbers. And sperm is such a beautiful it has a head, it has a body, it has a tail. Everything is important.
Yeah.
And this stress which a human body takes will affect the different parts of this bodies of this sperm. And anything which affects that will make the sperm less confident or less productive to have a normal child. Stress is very important. Second, habits. Smoking is the greatest, alcohol is the greatest. These two things kills the sperm speed. It just, they are toxins to the sperms. How they are toxin to the body, they are toxin to the sperm. And always we consider sperms are something different from a human body.
Yes.
And we think that sperm should go on its own when you abuse yourself. It won't happen. It will affect. Third is inability to get a correct balanced diet. Now for our any organs of the body, for our building the muscle, how we take care that we require a balanced diet to make ourselves good. People who are not taking a balanced diet, your sperms will go down. So these are the added factors. And fourth is nowadays the people's sleeping habit and waking up habit has changed.
Is it?
Yes, people sleep very late and get up very late. Now the sperm doesn't understand this. Human body has been made in such a manner that the sperm that much rest is required in the night. And that much he has to get up. Now once you are this cycle, this is called circadian rhythm, is being changed. Not only the cycle of each cell is changed in the body, including the sperm, but it changes the hormonal imbalances. And this creates lot of trouble. So the people are whole night, they are either, some of them are working late night for IT firms, that is fine, they can't do shifts. Some are purposely not sleeping because they are on the screen, mobile, and they spend a lot of time. Now at that moment they don't understand how much damage they are doing to themselves. But when the damage has become irreversible, then it is of no use. That's why the infertility has increased tremendously in younger people.
I think most people don't know.
No, they don't know this.
This
no,
part.
the youth doesn't know this.
No,
young people don't know.
If they knew, I think they would change their habits.
Very good. Now, just adrenal gland. You have also operated many cases.
Yes.
In fact, I started seeing specimens of tumors of only after you came to Goa. Before that was not being operated, they were sent out of Goa. So specimens of adrenal gland, like adrenal myelolipoma, few. It's Madhu who has sent, and it is good. I call him Madhu. He's my student, though he's very renowned Dr. Madhu. That such rare pathologies I saw only after he came. That's very important. First you started private practice, and you used to send the specimens I saw. And of course in Goa Medical College. Another thing in Goa Medical College, he started the transplant kidney. He's the instrument.
I know. We
from Bombay Hospital, and so it's even organ donation. All the rules, regulations, he is responsible.
He is a super expert.
More than that, also the students of his are superior to the other students because they are sage. I used to teach them in pathology. They used to come to my department for classes, teach them about the kidney tumors, bladder tumors, prostate, because they need to see the slides, etc. So as to teach,
that is there in the
very brilliant.
It's a part of their curriculum.
Part of their
yes.
career, and they are very bright.
Whatever little time we are spending
Yeah.
now, as a teacher,
Yeah,
I don't think so anybody can beat him.
exactly.
He makes it so lucid,
Listen.
and most people never
Yeah.
must have thought that stress, I'm under
Yeah.
anxieties,
See,
worries,
so-
and all that. But this type of
Madhu's all good qualities are a blessing and a benefit for Goa Medical College.
is for the
and the
community.
people of Goa.
Yeah, it's for the people.
And the people
It
of
is
Goa.
For the people.
It's for the people of Goa.
I want to ask you one question. Of course, nothing to do with this. What made you get into urology?
Why I chose urology?
Why?
Oh. As you said, I did my MBBS in Goa Medical College.
Why?
MS in General Surgery in Goa Medical College,
Why?
which is my alma mater.
Why?
Whatever I am is because of Goa Medical College. Like teachers like Sir, so many teachers were there, who has shaped us. Many students, many students.
Yeah.
Now after General Surgery, MS, then that time that was in 1997, 1998. That time the concept of super specialty was there, but it was not gone into the depth, particularly in Goa. And very few centers were there across which is giving super specialty. Super specialty means doing after MS you do MCH. MCH is a super specialty. And different branches. It may be cardiac, it may be neuro, urology and all these things. So as I was past my MS, then I thought that I should do MCH. Now for that our many centers were there. Initially there were centers like reputed centers like All India Institute of Medical Science, AIIMS, or PGI Chandigarh, SGPGI in Lucknow. They used to have their own exams during my time. Now it is a common, now it is a NEET super specialty. That time this institute used to have and very few Jovito seats, 1 or 2 seats per year of urology. Like MCH urology 1 or 2.
That's all.
Yes.
That's all.
And the whole Maharashtra used to give 6 to 7 MCH urology. And Maharashtra being close to us, I answered that exam, entrance. And for God's grace, for a parent's grace, my teacher's blessings, and for everybody's blessings of Goa, I feel I was chosen to do MCH in urology. Now, why urology? Because the filtering capacity, who controls the whole body is kidney. It's neither a heart, neither a brain. It's a kidney. Because kidney removes the total dirt of the body. It is in our house, how the person who cleans is the most important.
Yes.
Otherwise, house cannot stand. You may have a beautiful showroom and everything, but that cleaning part is most important. So I always felt that kidney is the backbone of each and every organ. And kidney is the only organ gets affected because other organs abuse that organ. So I felt that
A splendid way of
explaining you.
explaining.
So I thought that time I was so much got attracted towards this organ. Why I should not study in more depth? At MS General Surgery we have a knowledge which is quite general. That's why it has inclined me to do MCH in urology. And fortunately I had a great teachers. How I had a great teachers in Goa Medical College. I had a great teacher in my alma mater of MCH in Bombay Hospital, Dr. Ajit Fadke, renowned urologist, Dr. Punjani, Dr. Oza sir, Dr. Thatte sir, Dr. Kulkarni sir. These are 10, 12 stalwarts of that time of country were associated with sir with one institute.
Correct.
To impart the knowledge. And we got this legacy from this great Dr. Fadke sir, Dr. Punjani sir, Dr. Gaur sir, Dr. Thatte sir, Azza sir, and we are indebted to them. And I'll tell you, Jovito, when we started kidney transplant in Goa Medical College, my two teachers, Dr. Umesh Oza sir and Dr. Sadanand Thatte sir, they came here hand holding our full team to develop that kidney transplant program in Goa Medical College in 2009. And they associated with us for 10 more years so that the whole transplant program is stabilized in Goa. So I was blessed. Like, sir, whatever type of pathology specimen I given it to the sir. Sir at that time also being so senior, he is my teacher from the MBBS. Now when we are working fine, that is what that time also immediately in the night he used to give a call, this I found. So I was blessed to have these great people who helped us in making this our urology. So why I got urology and why that urology remained great is because of this.
And today we are blessed.
In fact,
that he is here with
I am
us.
very proud and happy that my student is really has shown and is shining. And wish him all the very.
We are blessed.
We are blessed. And Goa is blessed also.
I think we can have a special on the kidney transplant,
Yes,
organ
yes.
donation and all that.
Just to add here,
Yes.
you know, I am an professor of pathology. I am administrator. I was the dean of university and also the college. Now, sitting there, I have attended all the meetings of kidney transplant. But you don't know, when these students came to me, MCH, when I was teaching them, I asked him, you know, there was a two kidney transplants.
Yes.
So I said, how long does it take?
Yes.
And Mr. Jovito, they operate for hours together. They cannot come out.
Is it?
Yes.
It is a very sacrificial and
So
very
you
intense.
develop-
I came to know only from your PG student.
It takes
I said,
36
who
hours.
operated?
So
when we do.
you have to have super patience.
Who operated? How long it took? And he explained to me. And I was really shocked that it takes so long. The people don't know this.
No, they
Hold-
will- nobody will understand.
Doctors didn't. I did not know. Though I was the dean, though I was a
Whole day and night. it
Whole
comes.
day and night.
Yes. Continuously.
continuously.
Quite
When
a
it
tough-
is a-
Whole
when it
day
is
and
a
night.
knowledge.
And he told me we started at this and I came to know only because I asked them.
Yes.
Otherwise, you know,
Yes.
we don't go to as a professor of pathology.
Nobody will understand.
Nobody will understand. So anyway,
Doctor-
full kudos and credit
Yes.
to our.
Thank you. Thank
We talk
And his
about
team.
a little bit about urological oncology.
you. Yes.
And you must have been treating 5 cancers: prostate, bladder, kidney,
Yes.
testicular, and penile cancer also. Is this on the rise?
Yes. As how other malignancy, how other cancer is rising,
Yeah.
urological cancers are also rising.
Also there is.
Is it?
Now, there are, why they are rising? First is, number one is that they are really rising because there are causes which increases the cancer
Okay.
are becoming more and more prominent.
Yes.
Whether the lifestyle changes, genetic, exposure by the environment, pollution, water content, everything.
Correct. Same.
Second is our detection rate has increased now. Now we started detecting the cancer at a very early stages because of a tremendous advancement which has happened in the field of diagnostics. So these diagnostics, whether it is tumor markers, whether it is ultrasound, whether it is CT scans or MRIs or small biopsies or needle biopsies, they start picking up the cancers which normally never used to get picked up 20 years back. or
Is it?
15 years
Is
back.
it?
Absolutely.
Yes.
Imaging.
Yes, imaging.
And pathology.
Pathology.
And now AI is added to
AI
that.
is added to
Which
now.
will make it even
More. That's why
Continue.
the incidence and the prevalence of a cancers are increasing. Now, what you have said is correct. Prostate cancer is number 1 cancer in the world in the male. In India, it is third number as compared to this. Like how we have a cancer of a lung, cancer of a breast. Prostate cancer is top 5.
Top 5.
Top five.
yeah.
And you will be surprised, cancer of the prostate picked up in the early stages, no sir, it's curative. And cancer of the prostate is even it is unfortunately detected at a late stage also, there is a treatment where patient can live a good life.
Is it?
Yes.
Yeah, yeah.
So the prostate cancer should not be missed. And I will tell you very simple test of a blood test which we call as serum PSA. Prostate specific antigen is a tumor marker, is a precursor prior to development of a cancer. Detect that. Do that blood test every year from the age of 55 onwards, or in your family if you have a prostate cancer, that person should do it at the age of 45 and start picking up this PSA, because very few cancers, sir must be knowing,
Yeah.
very few cancers are curable.
Absolutely.
This is one of them. Other cancers like bladder cancers, we have spoken how common now it is becoming. Kidney cancers, kidney tumors are being picked up left and right because we are doing ultrasonography for so many other reasons.
All
Yeah, small tumors are picked up.
picked up.
You start treating them at that time, either surgically remove them, or there are percutaneous method also to dissolve those tumors. You are off from those tumors rather than getting the complication when blood starts coming in this. Penile ulcers, cancers have come down drastically because of a tremendous hygiene understanding by the people, and people do come forward. That social stigma associated with any tumor in the penis is slowly dying in Goa, not in India. In India, still most of the pockets of the rural India, they don't come out till they become so big. So the cancer of the penis, sir, what we used to see during our surgery training in general surgery in Goa Medical College, and now the incidence has drastically come down because they have been picked up at a very small stage where we can save his penis. Then the testicular tumors. Obviously, testicular tumor also has a taboo, has a stigma associated. People don't try to show their testes when they are increasing. So they must come forward because these cancers are increasing.
Before we wind up, they say that your field, urology, is one of the most innovative surgical specialties.
Absolutely true.
And it is pioneering modern, high-tech fiber optic and endoscopic techniques, minimally invasive surgery.
Correct.
Urology is now minimally invasive.
Yeah.
Because urology is the only branch which deals with endoscopes, microscopes, laparoscope, robotics, and fiber optics, and all types of digitalization. And now what sir has just touched upon is AI. AI and urology, AI in radiology are synonymous now. So this technological advancement of urology is so huge that we have to keep the pace with this technology, and this technology is helping. One of the example I'll give just before winding. Previously we used to cut open to remove one big stone.
Yes.
Now, 10 years back, we used to make one small hole.
Keyhole.
Yeah. Now there is no hole also. Now through penis also we can remove, because miniaturization of these endoscopes have become so brilliant.
Is it?
And the introduction of a laser, a methodology to blast the stone has increased. This technology has gone wide. Through natural orifice we can now treat. Prostate is treated through natural orifice. There is no cut outside. Malignancy can be removed by robotic or a laparoscopic method at one particular stage. Beyond that stage, open surgery is required only, because otherwise that clearance cannot be given. So this is the advancement in technology which, as you rightly said, which is associated with urology, and it is a fast pacing.
Before we end, lot of as you rightly said, imaging, robotic, AI, kidney, genes,
very good, sir.
genes and tumors.
Correct, sir.
There are lot of genetically
studies.
associated tumors,
Yes.
and we can diagnose them, and in younger age, etc.
Absolutely.
So this is another
And treatment.
and treatment,
Genetic treatment. Which is also huge in urology.
I think we have discussed quite a very interesting subject, but we need to call Dr. Madhu once again and disrupt his
after some time.
After some time, the organ transplant.
Yes. As he is the pioneer.
He is the pioneer, and he could throw.
And he is doing it.
Yes. Dr. Madhu, we are blessed.
Thank you for calling.
Goa is blessed.
Thank you,
Madhu.
I would put it, Dr. Wiseman, Goa is blessed.
Goa is blessed.
Thank you.
Absolutely.
And I think this is one of the brightest departments that we have.
Definitely.
But it all depends on the head, on the leader.
On the leader.
And the leader is none other than. I'm not just praising you, Dr. Madhu.
Thank you, Joy.
But
I'm very happy that my student
and very humble.
Very humble.
He still treats you as a sir.
that is what, that is my blessing. Young students today don't bother. Young students today are different.
I know. No, that's why.
But Dr. Madhu is different.
God will certainly. God has blessed you. God will bless you. And
definitely.
We need you to share all the good things that you are doing and you can do for the community at large. Not only for Gons, but for everybody who is watching this program.
Thank you.
Devaran Karon, Dr. Wiseman.
Thank you.
Tukalagon, to anga Paolo.
Obrigado.
Thank you.